various disease prevention. This is part of the CMB's long-term community health strategy. As we all know and believe in, prevention is better than cure. Among the preventable life-threatening diseases are the various types of cancers. Cancer cases in Tanzania are rising, usually picked up in advanced stages and very often missed. Early detection and screening and prevention can impact survival. Our guest today is Dr. Amin G. Alidina, MD, is a diplomat, American Board of Medical Oncology and Hematology. He graduated from Dow Medical College, Karachi, Pakistan in 1989, did his postdoctoral education and training in the USA from 1992 to 1999, and then worked in the USA and Canada. He has joined Aga Khan Dar es Salaam in October 2013. He treats all adult cancer patients. He is also capable of treating benign and malignant hematology cases. His interest is in screening, research, teaching, and of course, patient care. He was trained from Roswell Park Cancer Institute, New York, and has experience in working in many parts of the world, including Southeast Asia and now Africa. I will now welcome Dr. Amin to tell us how cancer could be prevented and how screening and early detection of cancer can save our lives. Thank you so much, and I hope you have a nice seminar. Thank you.
Respected brothers and sisters, leaders of the community, friends, thank you indeed for allowing me to come here. It's certainly an honor and privilege to me for coming here and be a part and parcel of you. I feel very comfortable, very happy, very good. So today we'll talk about cancer care, and as individuals, as a normal healthy person, what is it that I look out for in reference to early detection, prevention, what signs and symptoms I look out for, and what do I do, and just some general knowledge, and of course some awareness here, and finally your questions. And so we'll all address that with time. Next. So there are three major causes of death. The first one is cancer, second is heart, and the third is accidents. There are others also, but these are the three major causes of death. So when we talk about cancer, we are not just talking about cancer for no reason. That's a major cause of death. So next. And in cancer, we have three aims. Can we cure cancer? Meaning it's gone and gone forever. That's our ultimate aim. Or can we stretch lifespan? Sometimes we are not able to cure because it's picked up late. That's when we say, okay, Sawa, what else can we do for you? Can we make your lifespan from 6 months to 2 years? Sure. There are certain situations we can do that. There are times when we can neither cure nor prolong life. Then we focus on quality of life. Can we make the rest of your life comfortable? And that's also one of the very important aims of a cancer doctor. Next. So in the US, we have decline in deaths from cancer in younger people than 65, also heart. And in older people, the decline in cancer deaths are not that much, but decline in deaths from heart is there. In other words, we've succeeded in the US a lot in prolonging life or curing people from cancer in younger people, less than 65. Next. Next. When we talk about cancer, we have three arms. Surgical oncology, meaning we take your cancer out. It's a surgeon that takes it out. Or we do radiation oncology, meaning we give you light or radiation therapy and kill it. Or we give you chemotherapy or medication or pills called medical oncology. So 3 pillars of cancer: surgery, radiation, medical. But then we also talk about cancer screening, cancer prevention, bone marrow transplant, and supportive care, pain and symptom management, cancer support groups, social worker, dietitian. This is a whole group. When we take care of cancer, we help them out in these areas. Next. Let's talk about chemoprevention. What is chemoprevention? Meaning you take measures whereby you never get cancer. Is it possible? Yes, it is. It's called chemoprevention. Leads to no cancer. Of course, 1/3 of cancers are tobacco user. So if you cut back on tobacco, you automatically reduce your chances of developing cancer. Excess alcohol, not small amount of alcohol. Excess alcohol does lead to many cancers. If you do exercise regularly, we know that we cut your risk of cancer. If you have excess fruits and vegetables, that cuts your risk of cancer. Hepatitis B vaccine leads to reduction of liver cancer, and cervix cancer vaccine that is available at Aga Khan, both of these are available at Aga Khan, will prevent you from developing cervix cancer. So this is chemoprevention. These things will cut down the development of cancer. What about screening? What is screening? Screening is a battery of tests we do that picks the cancer up early and reduces death. For example, mammogram. A woman doesn't know she has a lump in the breast. She cannot feel it. She doesn't have any pain in the breast. She doesn't have any nipple retraction or discharge. Then when she has a mammogram, bingo, there is a tumor there. That's when she is totally fine. That's called screening. So mammograms for breast cancer, colonoscopy for colon cancer, and pap smear for cervix cancer. All these 3 will help pick up cancer early and hence cure. Sometimes they pick up early, intermediate, or advanced stages. There are times when we don't achieve cure, let's be honest with you. But screening and chemoprevention is what we like to focus today. Next. So in sub-Saharan Africa, breast cancer accounts for about 30% of all cancers in women. And cervix cancer accounts for also nearly 1/4 of all cancers in women. In men, prostate cancer is the most common cancer. There are other cancers like liver cancer, pretty common in men. Then we have colon cancer to worry about, lymphomas, and food pipe cancer, esophageal cancer. Now, Kapasi Sarcoma is a cancer that comes from HIV. So HIV disease or AIDS or HIV infection leads to pretty high incidence of cancer. That's another thing you want to avoid, is if you avoid HIV, that's how you avoid cancers by say. And this, on this side is the death from cancer. And again, breast cancer, uterus cancer, or cervix cancer remains high in women, and prostate cancer also is pretty high in men as death. Next. 85% of increase in cancer burden is expected by 2030. So what you have today, you will expect that 85% will increase by 2030. Awareness, screening, prevention strategies are lacking in Africa. We need awareness advocacy, like we are talking about it today. We need research, we need workforce, we need training, we need care, we need funding. All of this is lacking. National cancer control plans. It's not that you and I make plans, it's the government who has to make plans about large-scale screening, about large-scale vaccinations, and funding is needed for that. So this is not quite easy, but 715,000 new cases in 2008 were noted in Africa, of which 542,000 died. 75% of cancers in Africa died. Sad, isn't it? In Africa, 75% die of cancer because they wait too long, because the screening or prevention are lacking. In the US, 40% die, or 60% are cured. In breast cancer in the US, 80% live because they do mammograms for breast cancers. By 2020, approximately 1.5 million cancers are expected in Africa. In 2008, 715,000 were noted. So see the rise of cancer in Africa expected. So cancer is on the rise. Next. So there are very few radiation therapy services in Africa. In Tanzania, we have two areas, Dar es Salaam and Northwest. But in South Africa, we have more. Other parts of Africa, we have more. So in Tanzania, we have very few areas of radiation therapy available. At the Aga Khan Hospital, in the phase 2, we have the plans. And so that'll come down the road, but not at the moment. At the moment, it's Ocean Road that has radiation therapy. Next. What about morphine? Remember we said 3 aims: cure versus stretching lifespan versus taking care of your rest of the life with comfort. In the third case, we need morphine. Which are the countries in Africa that has morphine available? Tanzania has it. And today, by the efforts of our pharmacy department, we have it at the Aga Khan Hospital also. So Ocean Road has it, but the Aga Khan Hospital, where the oncology program has come, we have morphine available as well. But look at the other parts of Africa where morphine is not available. Can you believe that? So how people suffer from cancer when their life is coming to an end. Next. So what are the symptoms to watch out for? Well, a mass in the breast, or lump, or pain, or discharge, or nipple inversion speaks for breast cancer. A lump in the testicle, or pain, speaks for testicular cancer, very common in young men between the ages of 18 and 35, maybe even 40, testis cancer. If you notice a lymph node in the neck or in the armpit or in the groin, then watch out for it could represent a lymphoma. If you have blood in the stools, or if you've lost weight, or if you have diarrhea or constipation or pain in the belly, this could suggest bowel cancer or colon cancer. Very common here in Tanzania, we see a lot. If you have difficulty in urination, or you go to the bathroom very often at night, or pain, or your stream is poor, this could suggest prostate cancer. Remember, prostate cancer and testis cancer are 2 different cancers. Remember that this doesn't always mean prostate cancer, because there is a benign condition in which the prostate becomes big. It's called benign prostatic hypertrophy, which is not cancer, and sometimes it has these symptoms. So we do not know, but this could represent prostate cancer. If you have excessive breathing difficulty or cough or blood in the sputum, this can represent lung cancer. If you have postmenopausal bleed, meaning a woman has gone into menopause, and after a few years of, let's say at 50, her menses stopped, and then after 2 years or 3 years, she started to have bleeding again, this could mean a uterus cancer, unless proven otherwise. So this has to be taken seriously. Postcoital pain. A woman after intercourse hurts or has bleeding. This could mean cervix cancer, cancer of the cervix. If you have any changes in the skin that changes its color, gets bigger or looks different, watch out for melanoma. Of course, melanoma in this part of the world is not that common, but if you have melanoma, it's very angry, very aggressive, very dangerous. Next. Tobacco leads to many cancers: lung cancer, breast cancer, head and neck cancer, colon cancer, bladder cancer, cancer of the food pipe, cervix cancer, kidney cancer, pancreatic cancer, you name it. Literally, virtually, almost all cancers. Why get into tobacco? Why get into cancer? This is something you can prevent. Next. Excess alcohol, not just moderate alcohol, not even small amount of alcohol, but excess alcohol leads to liver cancer, cancer of the food pipe, breast cancer, head and neck cancer, meaning mouth cancer, voice box cancer. So stay away from these things. Excess alcohol, tobacco, these are some things you can help yourself against cancer. Next. So this is a study about breast cancer. Now it's comparing USA versus Aga Khan University, Karachi. See, in stage 1, 58% of breast cancers in the USA are stage 1. And in Karachi, only 15% are stage 1. Stage 2, 45%, meaning the breast cancer has gone to the lymph nodes in the armpit, as compared to in the US, 27%. So let's take US first. 58% are stage 1, 27% are stage 2, 5% are stage 3, and 6% are stage 4. And stages 3 and 4 are more so in the third world country. How is a lump identified? When we looked at in a data in Karachi, accidentally, meaning, you know, it started to give you discomfort. 93% of the cases were picked up accidentally. Self-breast exam, 3%. Clinical breast exam, meaning a doctor has picked it up, 3.5%. Mammographically, 0.4%. Look, this is where you need to pick it up early. Every year you should have mammograms done. So you pick it up early, thereby your stage 1 is high, thereby your chances of cure is high, meaning early detection leads to cure. Next. Same thing. The 5-year survival in the West is 80%. Next. So can you tell if you're going to get breast cancer? Well, you can go to a website and click and put the information, your age, how many children have you had, did you breastfeed, when was your first child born, did you have any family members having had breast cancer, and identify what your risk of developing breast cancer is. For average risk, let's take a number 1. For example, my wife doesn't have any risk. Let's give her number 1 as a risk. If she's had early menarche, it increases your risk by 1.2 against 1. Early menarche meaning your menses started early, before the age of 12. If you've taken hormone replacement therapy, it puts you on a higher risk. If you have a second-degree relative having had breast cancer, it puts you on a higher risk. If your age at menopause is late, after 55, it puts you in a higher risk. If you've had any breast biopsy, anything, not even necessarily cancer, it puts you in a higher risk. If your firstborn is born after the age of 30, it puts you in a higher risk. If you've had a biopsy showing atypical hypoplasia, it puts you in a higher risk. If you are older, just the age itself, if you're older than 50, that by itself puts you in a higher risk. It gives you a 6-fold higher risk of developing breast cancer than average risk. What can you do about it? You can't do anything about it. If you're older, if a woman is older, what is it that you can do about it, right? You just have to live with it. But I'm just telling you what the risk factors are. But by far the strongest risk factor of a woman developing breast cancer is having had a first-degree relative having had breast cancer. For example, her mother had breast cancer, or her sister had breast cancer, or her daughter had breast cancer. Look how high her risk goes, 14 folds higher than the normal risk. But I encourage you to click here and fill up the information and let the computer decide what your risk is. If your risk is more than 1.5 or 1.6, then there are strategies to lower the risk, chemoprevention, so that you cut the development of breast cancer by 50%. For example, one study showed that if a woman takes 5 years of tamoxifen, it lowers the risk by 50%. Before you do that, please talk to the doctor, because any medicine has its side effects, ups and downs. We have to discuss it out. Next. Here is a lady who's having a mammogram. Cannot emphasize enough on this modality. We start at the age of 40 every year, and then can be spaced out if the mammograms are fine. That's how you pick it up early, even before you start seeing problems. Next. So the various societies, the American Cancer Society says start mammograms at the age of 40. The American College of Obstetrics and Gynecology states starts at the age of 40. US Preventive Services Task Force says starts at the age of 50. It's a controversy of when do we start having mammograms between the ages of either 40 or 50, but suffice it to say that in Tanzania or East Africa, breast cancers happen much earlier than in the West. So it makes sense to have your mammograms start early. Mammograms to start at the age of 40. Self-breast exam, meaning once a month, do your own breast exam, especially in the shower, every month. And clinical breast exam, meaning a doctor or a nurse doing an exam, maybe at least once a year, maybe twice a year. Next. So 4 steps to good health is monthly breast exam, regular checkup, mammogram, and risk evaluation. You should get your risk evaluated. We talked about it. Increasing age, having a mother, sister, or daughter with breast cancer, having the result of a breast biopsy, beginning your first period after the age of 12, having your first child after the age of 30. And this handout, I believe you have, so you can go home and read up on that. Next. There's also some information saying alcohol leads to increased risk of breast cancer. Next. And that's excess alcohol. Okay. Let's move on now. So we talked about breast cancer. Let's talk about lung cancer. Remember, tobacco leads to development of lung cancer. This gentleman had a CAT scan, and look how small his lung cancer is. Can you imagine this is giving him symptoms or pain or cough or blood in the sputum? No, he doesn't even know about it. This is so tiny, look. And guess what? This CAT scan picked it up, and we took it out, and he's fine. So are we able to do CAT scans on everybody who is a smoker every year? No, it's too expensive. It's too expensive. This man can afford it. But what do we do about lung cancer? Well, stop smoking. Stop smoking. Please. Next. Next. Okay, so when you're a smoker, let's see what happens when you stop smoking. I mentioned to you, stop smoking. What happens to the risk of developing lung cancers? If you're a smoker, and if you've smoked 20 cigarettes or less per day, what is the risk of your developing lung cancer after you stop smoking? Smoking cessation. So let's assume that you never smoked, and still you can get lung cancer. I never smoked. Can I get lung cancer? Yes, I can. What is my risk? 1. Against which I take another gentleman who smoked 20 cigarettes a day, and his risk is 10, meaning 10 folds higher. 20 cigarettes or less. What happens when he stops smoking? Well, after 2 years, his risk actually goes up. Doesn't come down, goes up. Then it starts to come down, and it approaches that of a non-smoker after 15 years. So in the neighborhood, somebody gets lung cancer 5 years after stopping smoking, and he would say, "Doctor, I had stopped smoking. You told me to stop smoking 5 years ago. Still I got lung cancer." Well, the risk is there, but remember it goes up first because the changes carry on and then it starts to come down. Well, let's see if you've been a smoker less than 20 cigarettes a day. Now let's see if you've been a smoker more than 20 cigarettes a day. Against which, a person who's never smoked, his risk is 1. If you're a smoker and you're an active smoker, your risk is 21 folds higher than that of a non-smoker. When you quit smoking, it goes up, only for it to come down, but it never approaches that of a non-smoker. So first cut down on tobacco use, and early reduction is good because with time it does go down. Next. Tobacco, most avoidable risk for heart, lung, and cancer. 1 in 3 tobacco users die prematurely of tobacco-related disease. Active smoking, passive smoking, secondhand smoking, all at risk. Light, low-tar cigarettes, not safer, because then you smoke more. Filtered cigarettes is not an option, because these smaller particles go deeper into the lungs and cause a different type of cancer. Majority of smokers start by age 18. So communicate the message with your younger population, with your children, early on. Because once they start, it's difficult. But they usually start early. So explain to them early. Next. Oh, but what about prostate cancer? Prostate cancer is the most common cancer in men. So this man had aches and pains in the bones. A bone scan showed spots. See this spot here? This spot here? This spot here? All the skull. This spot in the spine, in the pelvic bones. All this is prostate cancer. His PSA was high. He was diagnosed with prostate cancer. You do not want to wait this far out for developing prostate cancer. You want to pick it up early. It's the most common cancer in men. It can be picked up early with just a blood test. Just a blood test. And this blood test should start at the age of 45. Everybody should get a PSA at the age of 45 and every year after that. There are other things that happen in prostate cancer. The urinary symptoms we talked about. Poor stream, getting up in the middle of the night, blood in the urine, pain. These things can also be symptoms for prostate cancer. I picked up my father's prostate cancer with just a PSA. And his PSA was high, but not very high. It hadn't gone to the bones. By the time it goes to the bones, his PSA is in the hundreds. Well, his PSA was around 10, normal being 4 or less. We took his prostate out. 15 years out today, he's fine. That's what we want to do. He's cured. That's what we want to do. We don't want to wait till you start having aches and pains in the bones or you have urinary symptoms and then get picked up. No. By then it's too late. Still, you can do a lot for them, but try to pick it up early. That's what screening is. So PSA testing is important for men for prostate cancer. Next. Next. Colon cancer. This healthy woman at the age of 50 had no risk factors, and she comes in for annual examination. She had a colonoscopy done, and a polyp was found. You know, I saw an ad in the news, on a TV, when this man, he turns 50, and his wife clinches onto him and puts her arm around his shoulders and her waist around his thighs, and wouldn't come off his back. And so first he thought he was joking. It's his birthday, his wife is on his back. Handled it, tolerated it, macho, carried on. But after a little while he got tired and he said, "Why don't you come off my back?" And she said, "I will not come off your back unless you give me one promise." And he said, "What?" She said, "Today you turn 50. I want you to give me a promise that you will have a colonoscopy done." This ad was by American Cancer Society. Such a powerful ad. I was a student at that time, and it stuck in my head. 50 is the magic word for every one of you to have a colonoscopy done once in 10 years. You don't need to repeat it every now and then. it'll pick up the cancer so early you won't even know about it. It's sitting there. The cancer grows and grows and grows, and by the time it comes to the surface and you feel it, it can be late. So pick it up early. That's what's called screening. Next. Next. So the various cancer societies would say, start at the age of 50, a test for colon cancer screening. It could be a colonoscopy. It could be just the checking of the blood in the stools. Your doctor might say, let's just check blood in the stools. That's also a very good test for picking up colon cancer. And so all these societies would say 50, 50, 50. 50 is the magic number here. Next. If you're over 50, you've not had it, and if you're in good health, and if your life expectancy is longer than 10 years, meaning you don't have any comorbidities, go ahead and have your screening done. Next. Okay. So cervix cancer. 75% reduction in cervix cancer, incidence and death because of pap smears in the US. Today, very few people die of cervix cancer in the US. While on the other hand, in Tanzania, guess which is the most common cancer? Cervix cancer. And in the US, it's the pap smear that picks it up early. So George Nicholas Papanikolaou, pap smear comes from here, pap, was a doctor born in Greece in 1883. He was a leper doctor, doctor of the leper community, leprosy. And in 1920, he studied the smear of the vaginal smear. And he found, can you go back? And he found in 1928 he published, the first observation of cancer cells in a smear of a uterine cervix was one of the most thrilling experiences of my scientific career. He was the one that picked it up. And in 1939, all women in New York hospital required a pap smear. Pap smear never went through phase 3. So in other words, it's as simple as having pap smear every year. Now you would say, you know, we come from a very strict Muslim community, and you talk about cervix cancer and the risk factors for cervix cancer. We don't have that. Do you really need pap smears? Next. Cervix cancer comes from a virus called HPV virus. We can now even check for HPV virus. Against HPV is a vaccine called HPV vaccine that is to be given to young girls, by virtue of which you eradicate cervix cancer. It can be now given to as much as age 40. So pap smear, HPV testing, vaccination should eradicate cervix cancer significantly. So what's happening to the world? What's happening to US, Canada, England, Australia? They're vaccinating the girls for against cervix cancer at the age of 10, at the age of 12. Guess what will happen to these girls? They will never get cervix cancer. Next. Can it happen in a very strict Muslim community? So we looked at data from Pakistan, and there are these very strict Muslim women. Even in them we found cervix cancer. They had cervix cancer. They had it older, when they were older, and their risk factors were different. You know, early marriage, multiple children, poor hygiene, these were their risk factors. As compared to in the West, it's the other risk factors that you all know about. So cervix cancer can happen to everybody. I vaccinated my daughter at the age of 12 against cervix cancer, because remember, if the daughter doesn't have any risk factors, the HPV virus can come from a man to the woman. So you never know. Sawa. Next. In England, in London, all girls at the age of 12 and 12 to 13 get cervix cancer vaccines. So this is now standard in many parts of the world. Next. So this is a Gavi Alliance. So you can say, well, vaccines are expensive. By the way, this vaccine is available at the Aga Khan Hospital in the pharmacy department. Vaccine is expensive. The Gavi Alliance is an alliance that has made cervix HPV vaccine very cheap, $4 each piece. We have to give 3 vaccines. The Gavi Alliance is supported by World Health Organization, various governments, Gates, and other foundations. They pour in money. In Switzerland, they put an alliance together, and these alliances are making vaccines for third world country for very cheap. And guess who's benefiting out of it? Well, Tanzania is one of them. Kenya, Ghana, Madagascar, other countries are doing that. There are certain countries that will make this nationwide introduction, meaning into their vaccination program. That is what we need. Next. This is Gavi Alliance, and these are the countries that are getting vaccines against it. They're making it very, very cheap. The prices have come down to $4.50 as compared to $25. And they will vaccinate by 2030, 30 million girls across 40 countries. China and India are taking huge benefit from Gavi Alliance. We need to do that too. Next. Next. Okay. Liver cancer. Okay, by the way, the same vaccine my son's pediatrician recommended to my son. My son is sitting right here. He's 9. Why? Because the same virus leads to mouth cancer and anal cancer. And that is also protected, prevented. So that's how far US is going. And we need to do that too. Next. Okay, liver cancer. Liver cancer is very common in this part of the world. Why? Because of hepatitis B and C. You can get that prevented if you vaccinate yourself against hepatitis B, or if you get treated for hepatitis B. Alcohol leads to liver cancer. This is liver cancer. Look, you can see this in the liver. This is liver. And there are other risk factors. So liver cancer, it's a difficult cancer. It's sneaky. It doesn't get picked up. But hepatitis B and C is preventable. Alcohol is also preventable. So you can prevent liver cancers from occurring. If you get it, then it's very difficult to treat. Next. What about testicular cancer? Who is this? This is Lance Armstrong, the famous cyclist, Tour de France, who got into the doping and those things. But you know, the truth is that he is, 9 times a cyclist winner. He suffered from testis cancer. When you have a lump in the testicle, young men, or a pain in the testicle, his cancer had gone to his brain. And he got chemotherapy, 10, 15 years ago, and he's cured. So this is one of the highly curable cancer. Most common in men between the ages of 20 and 34. Can occur in older people. Watch out for in the testicle any lumps, swelling, or pain. Very curable. Monthly self-testicular exam for men. Next. Stomach cancer used to be very, very, very common. So 50 years ago, guess which was the most common cancer? Stomach cancer. And what happens to it now? Well, it's because we used preservatives in those days. We didn't have refrigeration. We used preservative. Now we have fridge. Next. We're running out of time here. Head neck cancer is also quite common. Tobacco and alcohol and virus. We talked about HPV virus can lead to head neck cancer. Next. In summary, self-breast exam, clinical breast exam, mammograms at the age of 40. PSA, it's a blood test for prostate cancer. Prostate exam start at the age of 45 or 50. Stool blood testing, colonoscopy at the age of 50 for bowel cancer. Pap smear, HPV testing and vaccination for younger girls for cervix cancer. Hepatitis B vaccine or treat the hepatitis for liver cancer. People with family history should be more careful. Plenty of fruit, vegetable, exercise. Avoid smoking and alcohol. By 2050, 2/3 of the world cancer burden will be in the third world country, not in the West, because they are taking chemoprevention and picking up early and so on and so forth. But early detection leads to cure. This is very applicable in cancer. Next. Tobacco we talked about. Next. At the Aga Khan Hospital, we started chemotherapy infusion, and this is our team. We have 2 nurses and 2 pharmacists, and this is our first infusion. Pendo was our first patient. I thank Aga Khan Hospital in general and God in particular. I am healed and 100% cured. I was given specialized and professional treatment with all the support I needed. Next. Next. So, the most precious thing in life itself is life. Thank you. I'd be happy to take any questions.
Thank you, Doctor. What I'll do now is I'll start on the left, the middle, and the last row. So can we have questions from the left? Yes, Salibhai, 1 second. Let him just come back. Yes, Salibhai, please go ahead.
Assalamu alaikum. Doctor, how does the cancer start? In this part of the world with lack of facilities, how can you find out that you have a cancer? I'll give you an example of my late daughter. She had sarcoma, and she used to live in state. She had chemotherapy for 13 months. She was cured for 5 years. It came back and killed her. And I think chemotherapy is one of the reasons which kills the patient. I may be wrong.
Yeah, I agree that sarcoma is a difficult treatment, difficult cancer to cure. But you remember that despite her cancer, she got 5 years out from the treatment we gave her, or she got. In other words, there are times when we cannot cure her, then we go with the second aim, and that's stretching lifespan. So to achieve 5 years is because of the treatment that was given. But there are certain cancers that will come back years later. For example, sarcoma. For example, even breast cancer. So a woman is free of breast cancer now 10 years out. Can we tell her she's cured? No. We can never tell her it's cured. Because there are certain cancers, they go quiet and they come back very rapidly. They go into sleeping and then they come back again. Sarcoma is an uncommon cancer, but it is a difficult cancer to treat. And it just emerges from either the leg or wherever you have sarcoma.
Sarcoma is a children cancer which happens to children between age of 5 and 18. My late daughter had just a lump here, and she used to live in New York. They treated her. After 5 years, it came again at the tail of the spinal cord in the bone. First it was just in soft tissue. And they said it is a treatable cancer, because we went to Philadelphia, that's where she used to get treatment. And doctor said this is a treatable cancer, but it happened to her 1 in a billion, because it happened to her when she was 23.
There are different types of sarcomas. Some happen in younger people, and some even happen in older people. So osteogenic sarcoma or primitive neuroendocrine tumor or Ewing sarcoma are the ones that happen in younger people. And these are cancers that like to come back. But again, there is no warranty. Despite in complete remission, it goes away and then you never know it comes back. So we're sorry about that.
Ladies, you can also ask your questions. If you can write them on a piece of paper, then we can address them. Thank you. Please.
First of all, Dr. Amin, very nice and informative lecture. I'm Dr. Jamal from SIM, your colleague. I was in SIN Medical at that time. Nice, good lecture for the community, but just I want to add something rather than ask as a question. Out of these 9 symptoms which you mentioned, that these are the most important symptoms that we can find out what are the cancers to be developed. Out of that 9, at least 7 can be easily diagnosed with the help of ultrasound. As I am a radiologist, I know, and with the help of our community hospital, it's very easy to get some ultrasound and some basic blood tests like PSA and this, and pap smear also we can arrange with this. So we should go for something like this suggestion also for the community, that if we have the facilities, it's easy and very cheap for ultrasound and this blood test. Thank you.
Ultrasound is useful in certain cancers, for example in breast cancers, and it aids to mammograms. So mammograms has its own role. Sometimes we add ultrasound together with that, sometimes with the ultrasound of the armpit. Ultrasound is also very good in liver cancer and lymphomas and others. But there are certain cancers that require CT scans. There are certain cancers that require mammograms. There are even certain cancers that require a bone scan. For example, that prostate cancer gentleman I showed you with having had gone to the bones. So that requires other modalities as well. So when we do radiology in cancers, we do accommodate ultrasound, we do accommodate CAT scans, mammograms, bone scans, and many other tests.
Yes, please.
Why there is an increase of cancer everywhere? What is the main cause of being increasing this cancer? And what is the difficulty in detecting cancers? Are there other cancers which has not been detected yet? And are there cancers in animals also? I want to know these questions, please. I want to know these answers, please.
So the reason why, some of the reasons why the cancer is on the rise is because of longevity. People live longer. So, you know, it used to be life expectancy was 40. Now it's 70, 80 years. So there are people who have 2 cancers, first in younger age and then they have the second cancer as time goes by. That by itself is a risk. Remember, in the breast cancer risk, I told you age by itself is a risk. But the wear and tear happens as time goes by. The prostate keeps wearing and tearing and hence develops cancer. Ovaries develop cancers, breasts develop cancers, and that's why there is more cancers in the rise. So in a given time now we have more people, younger, older in that given time, and so the rise goes up. Number 2 is viruses and infections. You can say it's non-communicable, but it's still, hepatitis B leads to liver cancer. Okay, HPV virus leads to cervix cancer. In the future, there'll be more viruses causing cancer, and so there will be more detections come along. Common things common. Some common cancers we talked about. There are other cancers that are uncommon. For example, sarcoma is supposed to be an uncommon cancer. Is there any screening for that? No. Is there any prevention for that? No. But it can happen. So in the armamentarium of cancers, there are certain cancers we can talk about, we can prevent, we can early detect, but there are certain cancers that we don't have much to do, cannot do much about. After all, we are human beings, you know. So there is some powers that God gives us, some powers He doesn't give us. So we have to know the difference between the two. Animals also have cancers. It's amazing how much animal protection agencies support treatments for cancers. Sometimes we let the animals go because they suffer. That phenomenon also had happened in human beings, but it's controversial.
Middle row, please. Thank you.
Doctor, as you know, there are many anti-chemotherapy doctors right now who prefer herbal medicines, and I have read a lot about that from US. Those who go, they say that this kind of medicine, chemotherapy, it's just taking your money, but you can do alternate medicines. Is there any way this works?
So there is a chemotherapy called Taxol, a very useful, very important chemotherapy. And guess where this came from or comes from? The plants, the trees. There is a bar that produces Taxol. They used it, it worked. And now we manufacture in factories and use it in our chemotherapy unit. So there is some meaning to it. I recall a patient having had very difficult time with treatment, and he or she went away and took some herbal medicine and did get some benefit out of it. But remember that most of the patients that go and receive herbal care do not do well. So it really also depends upon what herbal medicine are we taking. There is so much we hear outside, but you have to remember that I'm a doctor of allopathic medicine. I know what chemotherapy does and what are the ways to cure. There may be some meaning in herbal medicine, and that could be used together with the allopathic medicine instead of independently, and we have to be very careful about which treatment to take.
Last row before before the doctor answers ladies' questions. Anybody in the last row, please? Yes.
Assalamu alaikum. I, doctor, would like to know about the GMO seeds. Recently, there has been some movement from some civil societies in the West, and they have written a lot of articles on this. The GMO seeds, they do cause cancer, and it is because of the GMO seeds that that cancer has become so prevalent. It's becoming, going out of, it's getting out of hand. And they also started saying that these GMO seeds should be mentioned on all the foodstuffs, that this is from GMO seeds. But these corporate giants, they had their own movements, and they quashed it, you see, and they never, this never happened. So if you could throw some light on these GMO seeds, please.
So there are certain food products that are in question. GMO seeds is one. But you remember that before the FDA pulls this out or labels this as precancerous, they have to have enough of evidence. There is information that comes with electrons, with microwaves, with powder, with perfumes, and so on and so forth. We can be more cautious and avoid products like these. While on the other hand, we would like to see some evidence. Now, to do studies like identifying cancers in people who've used GMO seeds is very, very hard, very difficult. How can you evaluate the group of people who used it as compared to the ones that didn't use it and say this group had more cancer than that group? And how would you know which group what the other group is? So controlled studies are difficult to assess. When you label something as precancerous, you have to think twice. And these large scientific studies are very, very difficult to label. You can say smoking leads to lung cancer. That's easy. You can say HPV leads to cervix cancer. That's easy. You can say hepatitis B leads to liver cancer. You can say alcohol leads to cancer. But when we label any food product, that's a very difficult thing to label. And that's where the problem is. That's where the controversy is, So I think for you and I think that we ought to be careful in our heart and heart, avoid things that we feel suspicious. But if you would like for evidence-based medicine, it's difficult to say.
Thank you. Yes, Ali.
Thank you very much, Doctor, for the informative awareness. The most common habit that I believe in our community is the chewing tobacco, which most of the youths as well as the adults are having at the moment. Could you kindly share some light as to how does this chewing tobacco affect us and the symptoms and the signs? And what kind of cancer does it lead to? Thank you.
So chewing tobacco leads to gingivitis, leads to dental caries, leads to mouth cancer, and also leads to food pipe cancer. So yes, chewing tobacco leads to cancer. It is in fact a higher risk of developing mouth cancers with chewing tobacco than with smoking. For example, smoking has risk to developing lung cancer. Chewing tobacco leads to mouth cancer and food pipe cancer. There's also some data to support that chewing tobacco indirectly leads to lung cancers. Of course, it's not the same as when you smoke and goes to your lungs and it damages your lung and leads to lung cancer, but more so locally and around the food pipe, which is when you swallow, it goes inside. Chewing tobacco is a risk to cancer.
Thank you, Doctor. There are some questions from the ladies. Curing cancer apart from radiation, chemotherapy, is there other way of curing it? Because at times people feel that it's better to die than rather going through this treatment. That's point number one. Point number two, they're asking electronics. I heard mobile phones usage of microwave. Is it true that it causes cancer? Please advise. Any side effects of cancer vaccination of young girls at the age of 10 to 13? Regarding the cervical cancer preventive vaccine, has its side effects been reached? Does PET scan also detect prostate cancer? What are the side effects of chemotherapy? And it said that these side effects can be harmful than the cure itself. Apart from alcohol, what are the other areas where breast cancers can be caused? We understand eating vegetables and exercise are good, but any other points that you can share with us? Yeah, these are the questions from the ladies.
I don't know if I can adequately answer all questions. I maybe missed out on some. I'll try to answer and then we'll go through the questions once again. Yeah? Chemotherapy isn't always given in advanced cancers. It can also be given in early cancers. So for example, in breast cancer, stage 2. Many times in stage 1, we do not require chemotherapy. But in stage 2, when the tumor has already left the breast and gone to the axilla or the armpit, we do offer chemotherapy. Now, chemotherapy does have its side effects depending upon what chemotherapy you use. There are 100 different chemotherapies you can be asked to take, and your doctor should go through the list of side effects, including hair loss, mouth sores, nausea, vomiting, etc. There are certain chemotherapies that doesn't make you throw up or vomit. There are certain chemotherapies that doesn't make you lose your hair. There are certain chemotherapies that make your menses go into menopause early. So it really depends upon what chemotherapy you're receiving and what chemotherapy is indicated in that particular case. Prostate cancer, there is separate chemotherapy. There are certain times we use anti-hormone therapy. For example, breast cancers and prostate cancers, those are not chemotherapies. So there are lots of armamentarium of different medicines we use in oncology, and hence each is separate. So there is the risk and the benefit that you need to weigh. If the benefit is higher than the risk, you go for it. If the risk is higher than the benefit, you don't go for it. If the benefit and the risk are equal, you discuss it out with your doctor. There are times when the benefit is way higher than the risk itself, you go for it. There are times when the benefit and the benefits are small. You can choose not to take it. But chemotherapy isn't that bad in this day and age. That depends upon your doctor. Can he help you not vomit? Can he help you stay well? Can he help you keep away from infection? There's one thing he cannot help you with, and that's hair loss. But the hair comes back after the chemotherapy is finished. But there are certain cancers, there are certain chemotherapies where hair is not lost. So you have to talk it out with your doctor. Each different situation is different. There was, at one point in time, a lot of hue and cry about mobile phone causing brain cancers. And that didn't pan out too. So in other words, that is not correct, that mobile phone causes brain cancers. So it doesn't have any proof of evidence. The side effects of vaccines are very few if at all. It's very safe to receive vaccines. The benefits are far higher than the side effects. Remember, we talked about the risk-benefit ratio here? The benefits are far higher than the side effects itself.
Thank you. I just sum it up. Thank you. Dr. Amin, sincerely from the bottom of my heart and on behalf of my community, I really thank you for such well-presented causes and the cures for cancer. I hope, ભાઈઓ તથા બહેનો, આપણી કોશિશ 4-5 વર્ષથી છે કે આપણે સ્મોકિંગ બંધ કરીએ આપણા કમ્પાઉન્ડમાં. શા માટે આપણે કરીએ છીએ કે સ્ટેટિસ્ટિકલી કેનેડામાં હાલ કંઈ રિસર્ચ કર્યું કે ઓટાવામાં they're saying that they have to spend $500 million of marketing against smoking so that they can save $10 billion in the future for curing these cancer patients. હવે તમે વિચાર કરો કે આપણા છોકરા, ગઈકાલે હું સ્પોર્ટ્સ ફેસ્ટિવલના ક્લોઝિંગમાં ગયો હતો, તો બહારની કમ્યુનિટીવાળો છોકરો, મારી સિનિયર ગાય, કેમ બેક ટુ મી એન્ડ સિટિંગ નેક્સ્ટ ટુ મી, મને કહે છે કે તમારી કમ્યુનિટીમાં આટલા માણસો છોકરાઓ પડીકી ખાય છે, બધાના હાથમાં હું જોઉં છું પડીકીને આમ કરે છે. વોટ ઇઝ હેપનિંગ ટુ યોર કમ્યુનિટી? ખરેખર તમે લાગે છે કે આપણા પાસે એટલા રિસોર્સિસ છે કે કાલે આપણા છોકરાને કેન્સર થાય ને we'll have enough resources to cure them all? The liability they will leave when they go with the families? Seriously, I think as a community, it is not only the chairman's job to highlight why I'm against cancer and pariki. It is because in the future, we as a community will not be able to cure the patients. આપણા પાસે ફેમિલીની લાયબિલિટી આવશે કે છોકરાને ભણાવવા પડશે, પહેણાવવા પડશે, બાપ નહીં હોય. તો ખરેખર મને પોતાને અફસોસ થાય છે કે આપણે કેટલી કોશિશ કરે છે કે તમે આ સ્મોકિંગ ના કરો, પડીકી નહીં ખાઓ, જીમ આપણે બનાવ્યું છે, બટ આપણી યુટિલાઇઝેશન is hardly than what me as a chairman desires. I think after today's presentation, I think it has opened our eyes. Let us be serious about our health, because without health, we as a community will not move forward. With those few words, ladies and gentlemen, thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh. Thank you.